Huwa niko na allergy. Huwa ninasumbuliwa sana na madawa.
Sababu nyingi hata baada ya kuponya mtu zinaharibikia mtoto.
Madawa mingi zinatupwa hapa Kenya na watu wanazichukua na zipeleka kwa maduka. Saa hizo wananchi wanaenda kuzichukua kununua, unapata zinawazuru.
Kuna zingine fake zinadhuru miili yetu.
Watu wengi wanaumia kwa madawa ambaye hayawasaidii.
It will cost someone's life.
I am aware of KEBS. I do not know any other body.
Kitu kama hicho hatujawahi kusikia sisi tukiwa mashinani huko chini.
Sijui. They've never heard about it.
Sasa sijai wasikia.
Yes, I know their existence.
Life is a laboratory to experiment the ways to live, fend off madness and chaos, solve problems, especially if they touch on our national well-being. One of the biggest problems facing our health sector is the proliferation of counterfeit and substandard products. A new report from the International Policy Network estimates that fake TB and malaria drugs sold in developing countries, for instance, kill over 700,000 people annually. That's equivalent to 4 full jumbo jets crushing daily. Pharmaceutical industry officials estimate that at least 30% of drugs sold in Kenya are substandard, a grave issue of public concern. Counterfeits and substandard products also include devices such as condoms that burst, another rubbery menace of graver private concern in the face of the fight against HIV and AIDS. And very few Kenyans knew the existence of the National Quality Control Laboratory, a specialized national institution, an important public facility that deals with quality of drugs and medical devices. Located on the second floor of the School of Pharmacy building, Kenyatta National Hospital Complex, the lab is a key player in the health sector, ensuring that counterfeit and substandard drugs and medical devices are minimized, if not totally eradicated, from the local market.
National Quality Control Laboratory for Drugs and Medical Devices, which we normally abbreviate as NQCL, is a government institution that was established in 1992 by an Act of Parliament as a body corporate with a clear mandate to test the quality of all the pharmaceutical products in this country.
But all labor that uplifts humanity has dignity and importance and should be undertaken with painstaking excellence. This the lab does via examining and testing of drugs through carrying out chemical, biological and physical evaluation besides conducting research. Indeed, as a center of excellence, the National Quality Control Laboratory achieved the World Health Organization status in July 2008, one of 6 labs worldwide and the only public lab to be recognized in sub-Saharan Africa.
It gives us the confidence that whatever test that we perform and the results that we release are things that people can have faith in and they can believe in.
The WHO pre-qualification status was a milestone, a 3-year labor of love, making us the premier drug testing facility in the region.
So I think for me these are positive things for which Kenya should be proud, for which this ministry should really flag out and tell the country, look, we are doing a good job.
It has been quite a journey for the laboratory.
The National Quality Control Laboratory can be traced back to 1978 when the Ministry of Health, with the information available to them, decided that there was need to have a unit to monitor the quality of medicines in the country. So they created a unit called DARU, Drug Analysis and Research Unit, which was given that mandate. It had the people from the university and the people from the ministry. It continued until the late 80s when they started thinking, because of now the number of activities which had significantly increased, it was felt they needed to have a lab, and this was eventually realized in 93.
But why did it take so long for Kenyans to know about this vital facility?
It has taken us that many years. We've been just in existence for the last 15 years, but we have developed the manpower, and we have also acquired state-of-the-art equipments, and we think now we are ready to offer this very important service to the public.
It is important that we have a well-equipped, well-run, properly resourced National Quality Control Lab for it to do its work effectively.
The lab tests pharmaceutical products upon request from the Pharmacy and Poisons Board prior to and after their registration.
Once we are through with the normal evaluation, we send the products to the laboratory for testing. And the results are sent back to us to incorporate into what we have been analyzing. The lab is almost, want them to operate more independently, really. And when we give them samples, we don't tell them it's from so and so. So they are more independent operational in terms of what they do. So they are doing a service for us.
I've asked the Pharmacy and Poisons Board to work with the team, an ICT expert team, to put up a method and a measure of barcoding our drugs. Drugs which enter in this country should have a special barcode, so that other drugs that come in the future which don't have that barcode should not be allowed into the country.
The National Quality Control Laboratory carries out drug analysis on request from KEMSA, pharmaceutical companies, medical institutions, NGOs and government institutions. Indeed, the lab contributes towards enhancing the regulatory capacity of the Ministry of Health Services' objective of improving the delivery of health services to all Kenyans.
The National Quality Control Lab is an institution under an Act of Parliament, Cap 244, amended 1992 of the laws of Kenya. It's one of the most critical institutions of government in terms of controlling the quality of drugs and substances that are brought into the country or that are manufactured locally. And we must ascertain the efficacy, authenticity of those materials or substances. Otherwise, you can of course affect or endanger the lives of the people if you don't have a way of knowing what materials you are dealing with.